I try to do it in the room because it's the furthest from the house, and then being upstairs, I'm hoping the air would go up. And I just put a little bit in there.
As a mother, this image may seem all wrong. But for Maria, she says she needs it to get through the day. She's a marijuana mom. And she's part of a growing number of women who smoke pot, either for fun or for medical reasons.
Before medical marijuana, even before him, I couldn't even really work that well because I was just constantly nauseous, and then I wasn't able to eat, and sometimes I would vomit all the time, so then I end up in the hospital dehydrated. What do you want?
Maria has a 2-year-old son. We agreed not to show his face. She says pot makes her a better mom. For years, she suffered with severe intestinal problems.
What color is that?
Still, even the smell of food makes her feel sick. She says she tried prescription painkillers like Vicodin, Percocet, and fentanyl patches.
In regards to the prescriptions that I was on, there's a couple years I don't even really remember.
But in Colorado, there was one other option she could try.
I keep, just maybe an ounce.
Maria, who asked that we not use her real name, says her doctor recommended marijuana to treat her condition, and it's perfectly legal. There are 14 states in the U.S. that legally allow medical marijuana use. But despite changing attitudes, there's still a stigma. And that's why some parents fear their children may be taken away. And so many of them keep it a secret.
That's why I don't want to show my son's face, and I'm worried about somebody just being out there, and maybe they work for social services around here and they think, oh, you know what, I really have an issue with that. And maybe they go out and they decide, I'm going to go and try to find who this person is, and I'm going to investigate him.
Denver's Child Welfare Division says it does not remove children from homes of medical marijuana users without reason. However, officials add, we are concerned with how the use of any substance impacts parenting, how the children are supervised while the parent is using, and if the child has access to the substance. David Lyman is living Maria's worst fears.
Come on.
His 7-year-old daughter, Hannah, was taken away from him in a custody battle in 2007. Are you okay? Lyman says using pot helps him deal with chronic back and neck pain, as well as injuries sustained in 2 motorcycle accidents. He says his wife knew he was using marijuana while they were married, but that it became the central issue in their visitation fight. The judge decided Lyman could no longer visit Hannah on his own, just father and daughter, unless he stops using pot altogether. He's now appealing 2 court decisions. Why not just stop using the medical marijuana and you'll get your daughter back?
Oh, that's what they're trying to force me to do. And you know what? I'd do it too. If I didn't really need medical marijuana. But because I do, I have no choice but to fight this fight.
Lyman admits he used marijuana well before it was legal. He says to self-medicate. In 2006, he was convicted of growing pot at his home. Now, he legally uses the drug and showed us his medical marijuana card. He says he doesn't understand how his child could be taken away just by following Colorado law and his doctor's orders.
What more proof do you want? No harm or accident came to my daughter, and nor will it ever.
But Lori Moriarty, a former police officer in Colorado, says she's heard stories like this before.
When I was the undercover drug commander, I had 4-year-olds drawing meth labs, drawing smoke pot pipes, drawing bongs. They knew exactly what their parents were doing.
Moriarty is now a vice president of the National Alliance for Drug Endangered Children. She concedes there are some parents who use pot for legitimate health reasons, but is convinced many more moms and dads are simply abusing the law.
For the first 7 years, we had 1,600 people who actually registered to receive their marijuana cards or medicinal marijuana. And in the last year alone, we're up to 60,000 with more than 1,200 applying daily.
In 2008, according to the Substance Abuse and Mental Health Services Administration, more than 4 million women ages 18 to 64, used marijuana nationwide. That's up from the year before. Back at home with Maria and her son.
Stir it with the special spoon.
They're making lunch. It's Maria's toughest part of the day. Being around food makes her feel nauseous. She does what she can to ease the pain herself, but then she's off for a hit. And another. 6, maybe more, on her bad days.